Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look into the dialyzable and the non-dialyzable. Dialyzable. So here the first one is the common dialyzable drugs. So in the common dialyzable, there is barbiturates, there is lithium, there is salicylates. So there's barbiturates, lithium salicylates, theophylline, caffeine, methanol, ethyl glycol, the sodium valproate, the isoniazid, as well as a carbamazepine. So all these are the drugs which are the commonly dialyzable drugs. Now we move on to the common non-dialyzable. The common non-dialyzable, it includes the amphetamines. So they are something you avoid. So the mnemonic is avoid. So it is A for amphetamine, V for verapamil, O for opioids and the organophosphates, I for imipramine, D for digoxin, and other D is for diazepam. To learn and grow daily like this, please do subscribe.